Okay, another question here that looks like the Pennsylvania House Bill 1899 and Senate Bill 908 seek to require licenses of those individuals who sell items to other people through the internet. Do you think anyone or everyone doing business with eBay and other online auction houses should be required to have an auctioneer's license? That's a new one, right?
Well, quite frankly, I haven't really studied that issue, believe it or not. You know, this gets back to government regulation and control and how important it is that we try to prevent too much of that control from happening. The answer is no. And I would go a step further and I'd say we need to take a look at so many things that are regulated and see if it's necessary or not. We need to stop those obstacles or prevent those obstacles that get in the way from conducting business. And, you know, it gets back to protecting what we need to do to help our business in this very difficult economic environment. And I don't believe there needs to be much more said on that one, Gordon. Thank you.
I think the question is, should we require licenses of people who sell items on eBay? I think that the short answer is no. But I think that there's a bigger question here, which is, what do we do with government regulation? I want to tell you that I'm a small business person, and there are certain regulations that I have to follow in terms of having buildings inspected by the codes department. I could say, no, I don't want any regulation. At the same time, there are many fires in rental properties where people die. And so there's some regulations that are good, that save lives, and there's some regulations that just help the bureaucracy perpetuate itself. We have to use wisdom and insight and sort them out. And the ones that are just there for the bureaucracy, we need to eliminate. The ones that save lives, we need to make sure that we have them. I think we need to take a practical, kind of rational approach to it. I just want to comment also that when we go to Harrisburg, whichever one of us, we can't just say no all the time, because we have to find compromise. We have to find solutions. That's what you're paying us to do. My job is to find solutions so that your lives are better, so that our lives are better, so our children's lives are better. And it isn't always possible to find a solution when you just say no. Sometimes you have to be able to reach across and find a way to say yes and still maintain principles.
All right, each of you have a chance to handle a dual question here as well. One, how do you feel about the governor's plan for state-supported health care? And the second portion of that would be, what specific programs would you institute to promote growth of business in Pennsylvania? So we're going to talk about health care and business growth in Pennsylvania. Box ticking, Dave.
Oh, it is? Healthcare. Well, I don't believe that there should be the government involvement. I'm strongly supportive of more of a privatized type of healthcare system, similar to the one that we're working with now. And I know Glenn Thompson had a comment about that too, as far as being still a very strong healthcare system that we have in place. What can we do to improve it? More insurance pools for small businesses, tax benefits for health insurance that individuals purchase, open it up more to out-of-state insurers being allowed to service residents in Pennsylvania, reduce insurance coverage mandates, encourage health savings plans, something that has been talked about for a long time. And thinking about it, you look at lowering taxes, like maybe if we had lower business taxes, employers could more afford to pay for health insurance. What a concept. And so why would we need the governor's plan that is nothing but a step closer to socialized medicine, something that would certainly give us a lot of problems and increase our taxes dramatically, just like we've seen in these other countries that have the socialized medicine.
I think that healthcare is probably one of the most pressing problems that we have to deal with, both because it's eating up our economic resources and because it's difficult for small businesses to try to offer healthcare and to try to compete for labor. I'm a small businessman. For me to be able to provide health insurance for my employees costs a tremendous amount of money. And I think we should look at whether or not it makes economic sense to have healthcare be employer-based. The reason being is that right now, General Motors is paying $1,500 of every car for health insurance. The companies that we compete with overseas, the international companies from Japan, are not having to factor that cost into their automobiles. Today, the average person will move jobs 10 times. 40 years ago, the average person stayed at the same job for 35 years. So you have tremendous amounts of problems with employer-based health care. There's another problem. We have 2,000 administrators of health insurance in this country. It is economically and technologically inefficient. Think about how many of you have had different health forms come to you. And those 2,000 forms are going back to various agencies when we have the technology to change it. I think we need to look at it, and I can't tell you that I would endorse and sign on to the governor's plan per se, but we need to change it. And I think that one of the ways we need to change it is to make it more affordable. I would agree with my opponent on many of his suggestions, making it more affordable, creating pools, inviting out-of-state insurers in for competition. I know people paying $1,000 a month for health insurance, self-employed people. I mean, it is a lot of money. And I think that we can do things to make the health insurance system work for us as opposed to working for very large insurance companies, which is what's happening now.